we begin, we'll be at the nurse's station at the computer. You're going to go ahead and review the patient's chart to identify the patient's medical problems, including whether the patient can sit or stand. You're going to also gather your needed equipment and supplies, and if body fluid samples are needed, you're going to include appropriate specimen containers. You'll need your blood pressure cuff, which is found in your patient's room. You'll need your pen light, your stethoscope, your second-hand watch, a notepad, pencil, and alcohol wipes. Once I've gathered my needed equipment, I would go ahead and head to the patient's room. I would make sure to ask the patient to empty their bladder before beginning their assessment and collect any specimens that are required. So I'm going to go ahead and knock on the door.
Come in.
Good afternoon. My name is Ms. Colder and I'm an instructor at South Plains College Vocational Nursing Program. How are you?
I'm doing okay.
Could you tell me what your first and last name is with your date of birth?
Tammy Holt, 3263.
Okay, and that matches what's on your armband. Ms. Holt, do you have any allergies to latex, iodine, shellfish, cleaning solutions?
No.
Okay. So I'm going to go ahead and perform a physical assessment this afternoon. So I'm going to go ahead and lift up your bed. If I needed a weight, I would go ahead and get one at this time. I'm going to go ahead and lift the head of the bed to about a 45-degree angle. And Ms. Holt, do you know what your normal blood pressure normally runs?
Usually 120/80.
About 120/80. Okay, so I'm going to pump up my cuff to about 150. I'm first going to locate my brachial artery. Again, that's going to be located on pinky side. So I've located my brachial artery. I'm going to place my blood pressure cuff about 1 inch above the antecubital space. I'm going to cleanse my stethoscope before we get started. Your blood pressure is 118/80. Okay, and then I'm going to go ahead and palpate the radial pulse found on the thumb side. I will be feeling for 30 seconds and multiplying that by 2, and then I will be monitoring my patient's respiratory status without her being aware of that for 30 seconds and multiplying that by 2. Going to go ahead and get my patient's temperature. Depending on the device that I'm using, I would make sure, since I'm using the temporal scanning, I'm going to go ahead and make sure that my patient's forehead is nice, clean, and dry. I'm going to place that right at the forehead. And I'm going to get a tympanic reading of 98.6. If I was using a tympanic, I would pull the pinna up and back and insert my probe into the ear towards the mandible until that reading beeped at me and let me know what my reading was. Okay, I'm going to go ahead and come place the probe on my patient's finger to get a pulse ox reading. Okay, so Ms. Holt, I'm just going to make sure that your finger is nice, clean, and dry. I would make sure that my pulse ox was cleaned with alcohol prior to use. I'm going to place that on my patient's finger for about 30 seconds. And we get a reading of about 99 to 98%. Patient is on room air. And then Ms. Holt, are you experiencing any pain right now?
Yes, I am.
Okay, where is your pain located?
In my right knee.
In your right knee. On a scale of 0 to 10, could you rate that pain for me, with 10 being the worst?
A 2.
A 2? Okay. Can you describe that pain for me? Is it dull, achy, crampy?
A dull, achy pain.
A dull, achy pain, okay. Do you need anything for that right now?
No, I'm used to it. I have arthritis in that knee.
Oh, okay. And then Ms. Holt, do you know where you're at?
I'm at MSPC Hospital.
Okay, do you know what brought you in today?
Yeah, I came in with some abdominal pain.
Some abdominal pain, okay. All right, well, I'm gonna go ahead and I'm just gonna look at your eyes. I'm gonna see what your pupil size is, and then I'm gonna shine a light in your eye, okay?
Okay.
Okay, looks like your pupil size is about a 4 millimeters, okay? So now what I'm gonna have you do is just look straight ahead, and I'm gonna shine a light into your eye, making sure that your pupils constrict and dilate. Okay. And then Ms. Holt, if you will, please, if you'll look at my pen,
Okay.
and then look at the ceiling,
Okay.
and then look back at my pen.
All right.
Okay? So pupils are equally round and reactive to light and accommodation at 4 millimeters. Okay, and then now I'm just going to go ahead, Ms. Holt, will you go ahead and smile for me?
Okay.
Okay,
Smile.
patient smiling, face is symmetrical, the sclera is white and smooth, the conjunctiva is pink and moist. I'm going to go ahead and inspect the mouth. So Ms. Holt, will you go ahead and say "aw" for me? Okay, looking at the tongue, looking at the gums, the teeth, making sure that they're intact. Mucous membranes are pink and moist. There's no lesions, sores, or drainage. I'm looking in the nares, making sure that they're pink and moist. There's no drainage. Looking in the ears. Okay. And then of course I'm looking at my patient's skin color as well. If need be, I would go ahead, if I had any reason to change my gloves at this time, I would do so. Since I did not contaminate, I'm going to remain with my gloves. I'm going to go ahead and feel for the carotid pulses one at a time. So I'm going to place my hands on your neck. Okay. Okay, and carotid pulses are strong and equal bilaterally. I'm going to go ahead and look at your neck, looking for vein distension, and it looks like you have flat veins. Again, making sure that that head of the bed is at a 45-degree angle. I'm looking at her trachea. Ms. Holt, can you go ahead and swallow for me?
Go.
Okay, did you have any problems swallowing?
No, I didn't.
Okay, so there was no jugular vein distension or tracheal deviation noted with the head of bed at 45-degree angle, and the patient denies difficulty swallowing. I'm going to go ahead and lower your gown to inspect your chest.
Okay.
Okay, so again, I am inspecting the chest for the shape, the symmetrical excursion, so that equal chest expansion, the use of any accessory muscles, and the ease of breathing. Okay?
Okay.
I'm also going to be inspecting your skin to see if you have any bruising, any drains, devices, IV sites, if there's any oxygen in place, and there is none of that. So again, I'm going to go ahead and cleanse my stethoscope once again. I'm going to feel for skin turgor. It's elastic in less than 3 seconds. I'm going to go ahead and auscultate the heart sound, starting with the apical pulse, located left midclavicular line, 5th intercostal space down, for 1 full minute. And I would go ahead and compare that to the radial pulse to make sure that they are equal. I'm going to go ahead and start listening to the respiratory system. So again, I'm going to start by the right upper lobe. Comparing it to the left upper lobe. Right lower lobe. Left lower lobe. Okay, now I'm going to listen laterally. Right upper lobe. Left upper lobe. Right middle lobe. Right lower lobe. Left lower lobe. Okay. And then I'll listen to your posterior breath sounds when we get ready to turn you, Miss Holt.
Okay.
Okay, at this time I'm going to go ahead and lay you flat. And I'm going to be inspecting your abdomen. I'm just going to be looking for any bruising, your skin integrity, for dressings, wounds, or tubes.
Okay.
Okay, inspecting the abdomen. Again, making sure that she doesn't have any of those things going on. I'm also going to auscultate bowel sounds in all 4 quadrants, starting with the right lower quadrant. I would listen for 15 seconds, multiply that by 4 in all 4 quadrants. If I didn't if I heard any irregular bowel sounds, I would listen for 1 full minute. If I heard absent bowel sounds, I would listen for a minimum of 3 minutes.
Okay.
And now I'm just going to feel on your abdomen. If you have any pain, discomfort, feel any nausea or vomiting, please let me know, okay? I'm just feeling for any masses or anything like that. Okay, do you have any pain or discomfort?
Just a little discomfort.
Just a little discomfort, okay. Miss Holt, when was your last bowel movement?
It was this morning. I finally got my stool out. That's what the doctor said was wrong, and I was ending up with constipation and gave me a lot of stomach cramps.
Okay, when you had your bowel movement, can you describe that for me?
Yeah, it was a large amount, and it was formed kind of hard.
Okay. What about your last void? When did you last pee?
This morning.
This morning. Did you have any pain, discharge?
No.
Do you have frequency when you go? Do you have to go very often?
No. It's normal.
Normal. So would you say it was clear yellow?
Yes.
Okay. And then obviously I'm just going to kind of look. You don't have a catheter. Peri area is clean and dry. No problems noted. If my patient was of childbearing age, I would ask when their last menstrual period was. I'm going to go ahead and lift the head of the bed back up. I'm going to go ahead and palpate both radial pulses at the same time, checking for strength and equality. Okay. Radial pulses are strong and equal bilaterally. I'm going to go ahead and inspect my patient's arms, so looking at skin integrity, lifting up the patient's gown, making sure she doesn't have any bruises, IV sites, or any skin breakdown. I'm going to go ahead and use the dorsal side of my hand, assess the temperature, look for any moisture or edema. I'm going to go ahead and assess cap refill on both hands. So again, pressing down on the nail bed and releasing. Cap refill less than 3 seconds. Doing that on the opposite hand, pressing down and releasing, less than 3 seconds. Okay, you still doing okay, Miss Holt?
Yes, doing well. Thank you.
Okay. I'm going to go ahead and have you kind of lift your arms out to the front, to the side, and back down for me.
Okay.
Okay, so full range of motion is noted. I'm going to go ahead and have you squeeze my fingers for me as strong as you can.
Squeezing.
Okay, and it's strong and equal bilaterally. I'm going to go ahead and work my way down to the legs. So I'm just going to go ahead and expose you for just a second. Okay, so again, I'm looking at the legs, inspecting, making sure that I'm looking at skin integrity, making sure that there's no skin breakdown, there's no lesions, there's no redness. I'm going to go ahead and be palpating the legs, making sure to get the calf. Do you have any calf pain upon palpation?
No.
Okay. I'm going to go ahead and palpate the pedal pulses. So I'm going to go ahead and locate those. Pedal pulses are strong and equal bilaterally. I'm going to go ahead and have you push on my hands for me.
Pushing.
And then if you'll pull back towards you.
Pulling.
Okay. And then I'm going to go ahead and assess cap refill on both big toes. Both are less than 3 seconds. I'm inspecting the toes, assessing for skin breakdown. Can you go ahead and you wiggle your toes for me?
Wiggling.
Okay. And then if you could please, could you put your legs up, down, side, and back to the front?
Okay, I've done that.
Okay. So full range of motion noted to lower extremities. At this time, again, I've already inspected to make sure that there's no tubes, equipment, dressings, to the arms or legs. If there was, I would make sure that they were patent and function appropriately. This time I'm going to ask if I could get some help to turn my patient.
Okay, I'll be right here.
Okay. Okay. Hello.
Hi, I'm Vanessa. I'll be your CNA today.
Thank you. Thank you for washing your hands. Okay, so we're just going to be turning Miss Holt towards you today so I can assess her backside and listen to her breath sounds.
Okay. Hi, Miss Holt.
There we go. Okay.
We have that draw sheet too.
Yes. Let me pull this.
I'll grab
Okay, ready?
1, 2,
2,
3. All right, Miss Holt, just hold on to this railing for me.
Okay.
You're
Again,
doing good.
looking at her backside, looking at her head, scapula, back, coccyx, legs, her calves, especially the heels, elbows, everything's intact. Peri area is clean and dry. Now I'm going to be listening to her posterior lung sounds. Again, I'm going to cleanse my stethoscope. Left upper lobe. Right upper lobe. Left lower lobe. And right lower lobe. Okay. And then we're going to go ahead and make sure that those sheets are straightened, and we'll go ahead and turn her back to her back.
There you go.
Okay. All right. Thank you. And then if you'll just wash your hands or do hand hygiene upon leaving.
Okay, I can do that.
Thank you.
Uh-huh.
Okay. I'm going to go ahead and cover Miss Holt back up. Miss Holt, are you doing okay? And she's going to say yes.
Okay, yes.
Okay. You come over and straighten these covers for you. Are you hurting still?
No, I'm feeling a lot better.
Feeling a lot better? Okay. So I'm just going to go ahead and lower you back down. Your call light's within reach. It's right here. You got your side rails up. I'm going to go ahead and lift your head just a little bit.
Okay.
And the bed is locked. It's in the lowest position. I'm going to go ahead and get your belongings and put those next to you.
Okay.
Do you need anything before I leave?
No, I think I'm okay.
You're okay? Okay, so then again, I'm going to hand hygiene upon removing my gloves. I'm going to place her water in her pitcher within easy access. I'm going to go ahead and perform my second safety check. Again, that is locked, lowest position, side rails up ×2, call light within reach, personal belongings are within reach. There's no tubes or drainings. If there was, I would make sure that they were draining appropriately. Ms. Holt, I'll be back in about 30 minutes or so. If you need something, please press your call out and I'll be back to check on you, okay?
Okay, thank you so much.
Okay, thank you. And that's going to conclude our physical assessment.
Thank you.
Thank you.
Stacy, thank you for performing your assessment. I will be right there to give you your feedback.
Okay, thank you.
Hi,
Hello.
Stacy. Okay, I'm your grading faculty today, and
Okay.
I'm here to give you some feedback on your performance.
Okay.
And I first want to tell you that you did a great job overall. I was really impressed with your performance.
Thank you.
You did everything except for a couple things I wanted to give you that feedback on.
Okay.
So if you recall on your rubric, under the head and neck portion of your rubric, step number 2, You did forget to mention that you needed to change your gloves after checking the sclera and conjunctiva if your gloves had become contaminated.
Yes, I remember that, yes, okay.
Okay. And then the only other thing that you missed was under your cardiovascular portion of the rubric, when you're inspecting the chest for bruising and skin integrity, your subclavian lines and oxygen use, don't forget to ask the patient if they have a cough, and if so, whether it's if it's productive sputum.
Oh, okay, yes, I forgot that. I always miss that step.
Okay.
Okay.
All right. Well, good job. Keep practicing.
Okay, thank you
All
so
right, you're
much.
welcome.